Hi guys, we're going to talk about Chapter 11, Career Planning and Development in Nursing. And career planning really needs to start right now as you're about to enter your career. You should start the planning process. So career development should be viewed as a lifelong process involving both the individual and the environment in which he or she lives. It is accomplished through self and work environment assessment, job analysis, education, training, job search, and acquisition, and work experience. Career development in an organization must include more than management employees. It starts at direct care employees as well. So, question: tell whether the following statement is true or false. Career development occurs in the early phases of one's work life during the period of education, training, and job search. An easy one. False. Career development should be viewed as a lifelong process that can be accomplished through various means, including education, self assessment, and work experience. So career development isn't just at the beginning of your career, it's something that happens at throughout. While it should happen at the beginning of your career, it's something that never ends, it's constantly evolving. So career stages, there's the promise stage. This reflects the first 10 years of employment, making wise career choices is very important. Milestones include socialization to the nursing role, building knowledge, skill, abilities, credentials, and an education base, gaining exposure to a variety of experiences, identifying strengths and building confidence, and positioning for the future. Then you go into the momentum stage. This is the middle career phase and typically reflects the nurse with 11 to 29 years of experience. Milestones include further building confidence in one's competence, developing experience, gaining mastery, and establishing a professional track record, and finding a voice through aligning strengths with your passion. And the harvest phase is late in the career. This is evaluating the mastery to stage practice for advancing the profession and positioning as a professional statesperson and establishing your legacy. And then career planning includes evaluating one's strengths and weaknesses, setting goals, examining career opportunities, preparing for potential opportunities, and using appropriate developmental activities. Justification for career development are that it reduces employee attrition, it provides equal employment opportunities, it improves the use of personnel, it improves the quality of work life, it improves competitiveness of the organization, it avoids absence and builds new skills, and it promotes evidence-based practice. Many nurses lack a career focus and instead view nursing as a job. So this is where we really talk about nursing as a profession rather than nursing as just a job that you clock in and out for. The viewpoint of nursing as just a job limits opportunities for professional advancement and professional growth because that cannot be imagined rarely, and it rarely becomes the reality. Many novice professionals and most young people neglect to make long term career plans, which can be detrimental to your career. Um, Shirley suggests that extraordinary careers do not just happen, they are cultivated and planned. It's very important to continuously be planning your next steps in your career. It's great to be happy where you're at, but it's not, and it doesn't necessarily have to mean a job change. It could be a change within professional organizations and advancing your career by networking and joining a local chapter of a professional organization and maybe moving into a leadership role within that, that then can eventually help you possibly advance your job and change into a different career path. So, responsibilities for career development when it comes to career planning, and that's the individual, me, myself as a nurse. I need to be doing self assess interests, skills, strengths, and with weaknesses and values, determine goals, assess the organization for opportunities. So, look at where I'm at. Are there opportunities for growth in what I want to do? Assess for outside opportunities. So, Look within your organization, but then also look for opportunities outside your organization. Develop strategies for how you're going to achieve your goals. Implement a plan, constantly evaluating your plans, and reassess and make new plans as necessary, at least biannually. And then career management on an organizational level, what an organization needs to do to help develop careers is to integrate individual employees' needs and organizational needs. Establish, design, and communicate and implement career paths with their staff. Disseminate career information. Post and communicate all jobs for the organization openings. Assess employees' career needs. Provide work experiences for development. Give support and encouragement. Develop new personal policies as necessary, at least biannually. And provide training and education. The organization's responsibility for career management, it's integration of needs, establishment of career paths, dissemination of career information, posting of job openings, assessment of the employees, provisions of changing assignments, giving support and encouragement, develop of personal policies, and provisions of education and training. So, which are an organization's responsibilities for career management? Select all that apply. A, posting job openings. B, offering support and encouragement. C, providing education and training. D, determining the course of an employee's career. And E, all of the above. The answers are A, B, and C, posting job openings, offering support and encouragement, and then C, providing education and training. An organization has many responsibilities in career development, but each employee's needs, skills, and personal choices should also largely influence the course of his or her career. Career coaching steps include gathering data, asking what is possible, and conducting the coaching session. Career coaching involves helping others to identify professional goals and career options, and then designing a career plan to achieve those goals. In short-term career coaching, the manager regularly asks employees questions or challenges them to refocus their perspective or improve their performance. So long-term coaching is planned, systematic management action that occurs over the duration of the employee's employment, should occur at least annually in addition to performance appraisals, and includes data gathering, assessing what is possible, and performing coaching interviews. Tell whether the following statement is true or false. Regular data gathering from employees is an example of long-term coaching. This is true. Long-term coaching includes data gathering in order to assess possibilities. So management development is a planned system of training and developing people so that they acquire the skills, insights, and attitudes needed to manage people and their work effectively within the organization. It is often referred to as succession planning. Many nurses feel they lack the knowledge and experience necessary to become a manager. It must be supported by top-level administration. It must be planned and systematically implemented. It must include a means of developing appropriate attitudes through social learning theory and adequate management theoretical content. Tell whether the following statement is true or false. Management development can be initiated in any level of an organization independent of the administration. This is false. Management development must be supported by top-level administration or it will never work. In management development programs, top-level management should bear the cost of management development classes and create an organizational structure that allows managers to apply their new knowledge. Whenever possible, nursing administrators should teach some of the classes and at the very least make sure that program supports top management philosophy. So this is a way for direct care nurses or maybe those that have moved into like a team leader role to start learning those management skills so that they can possibly take on that lower level management in the future. Areas of nursing competency assessment is improvement for the quality and safety of the healthcare system informatics, evidence practice, knowledge of complex systems, skills and methods for leadership and management of continual improvement, population health and population care based care management, and health policy knowledge, skills, and attitudes. These are all areas that nurses can be assessed on. Professional specialty certifications. Nurses must meet eligibility criteria that they may include years, types of work experience, as well as minimal educational levels, active nursing license, and successful completion of a nationally administered exam. Certifications normally last about 5 years. So as a new nurse going in, knowing whichever area you decide to work, almost every area of nursing does have a certification. You guys, we discussed it previously at one of our discussion boards. We kind of reviewed through some of the professional practice organizations. You guys all know my background's critical care nursing, so AACN is what I used for my certifications. And for example, if you went into critical care, or even if you went into acute care, and we're like in a step-down unit, and the AACN, American Association of Critical Care Nurses, was the organization that you decide to align yourself with, they have multiple certifications you could take depending on your area of expertise. So if you were pediatrics, if you were progressive care, or if you were critical care, they have, or even neonatal care, they have 3 to 4 different certifications in those areas that you, once having 2 years of nursing experience is their requirement, you'd have to be signed off by nursing leadership that's part of your application. It's actually hours of work, not years, but it ends up being about 2 years of work. Then you can sit down for the certification. When we say the certification lasts for 5 years, that just means the renewal process is every 5 years. You don't have to retest typically, but you would have to keep so many CEUs up and submit that somewhat like you do with your licensure for nursing. There's certifications and everything, though. If you go into OR, if you are med-surg, there's a med-surg certification. Any area that you decide to go into, you can certainly, after a certain amount of time, it's typically at least over a year. So if that's something you're interested in, which it should be, you can look into that and ask your nursing leadership what certification best suits the area you're working in. Personal benefits of professional certification. It provides a sense of accomplishment and achievement. It's a validation of specialty knowledge and competence to peers and patients. It increases your credibility. It increases your self-confidence. It promotes greater autonomy of practice. It provides for an increased career opportunities and greater competitiveness in the job competitiveness in the job market, and may result in salary initiatives. Many organizations provide incentives by either offering a differential for your certifications, or if the organization has a clinical ladder that can certainly help towards your advancement up the clinical ladder. Career planning and the new graduate nurse. So you guys, it's really important to transition to practice programs or residencies, and many of you are starting to apply for residencies. Be funded by employers, and it usually lasts 6 months to a year of your employment. The resumes should be typed on good paper in a format that is easy to read. The resumes should maximize strong points and minimize weaknesses. The style should reflect good grammar, correct punctuation, proper sentence structure, and simple, direct language, and a cover letter should be included. All nurses should maintain a portfolio to reflect their professional growth over their career. Okay, that's it for Chapter 11. Thanks, guys.